What trends do you see?
There's a lot robotic CAD/CAM technology, and then all the new scanning, 3D printing, and also on X. I didn't have any mentor help me throughout my way of doing it. So like kind of like a trial and error. So you're gonna run into complication and you don't know what to do.
All dentists know the common career paths, but how do you know which path is right for you, and are there other options out there?
On this podcast, we will be chatting with industry experts. We want to bring you the knowledge and resources you need to take your career to the next level and break down those industry secrets interview by interview
We are here to ignite a revolution in the dental landscape.
and help you, the dentist, build the career you have always wanted.
I'm Dr. Cassidy Reeder,
I'm Carter Frank.
and welcome to the Revolution Dentistry Podcast.
I'm Carter Frank here with Dr. Cassidy Reeder. This is the Revolution Dentistry Podcast, where we will help you with strategies to build lasting success for yourself and for your family. Today we have a very special guest, Dr. Cory Nguyen. Dr. Cory Nguyen is a highly accomplished dentist and implant specialist who is here to share his expertise in this critical area of dentistry. Dr. Nguyen earned his DDS degree in 2004 from the Baylor College of Dentistry. He finished his postgraduate implant training from the Medical College of Georgia School of Dentistry. He's currently residing in Dallas, where he performs 30 plus all-on-X cases per month for his practice, Beyond Dental and Implant Center. He is a diplomat of the American Board of Oral Implantology and the American Board of Dental Sleep Medicine. He is a fellow of the American Academy of Implant Dentistry and the International Congress of Oral Implantologists. Dr. Nguyen has been featured in the Disruptors magazine as a top 30 dentist in the U.S., also as the recipient of the Texas Top Dentist Award. He is dedicated to helping patients reclaim their wealth and live fuller, happier lives.
Dr. Cory, that's an incredible amount of achievements that you've had throughout your career. You've had so much experience in the all-on-X sector, and you've no doubt helped change so many people's lives. Can you talk to us a little bit about your life and how you got into dentistry?
Well, you know how I was born in Vietnam
Okay.
originally, and um, I was the youngest one of nine in my family. So, and when I was there, I kind of had witnessed, the whole, um, like experience with people having bad teeth. Like they have all kind of
Yeah.
dental problem, and we have limited access to dental care over there. So kid, they don't have any dental IQ, even the parents, so we don't even actually go cleaning every 6 months. So they all have dental problem. So that kind of like make me realize that we really need somebody to help them down the road. So my goal, I feel like being a dentist, you can help so many people near and far. Also, when I came over to America when I was 17, start my new life with a
Wow.
new country.
Yeah.
I didn't know how to speak English at all. And but lucky that I was born in a family where we got four dentists and then two dental lab technicians. So, through my college year, I worked for my dental for my brother at the dental laboratory. So I learned the
Wow.
hand skill, from working there. And then also visit my brother, oldest brother, office, and his wife, the dentist too, and his daughter's the dentist also. So I
Wow.
see dentistry at first hand. So kind of
Yeah.
exposed me to different aspect of dentistry. So and then see the outcome and the result from what they done for other patients at their practice. So kind of like intriguing, me to want to be a dentist too. So that's how the journey started.
Wow. I mean, the amount of challenges you've had to overcome to be a dentist, it's very, very inspiring.
I mean, it's a little rough at the beginning when I came to America. I have to start all over again. And then now I got into dental school, and I have a drive that I want to be better every day. So
Hmm.
so going to dental school, I went to dental school. I graduated from dental school, and then after that, I took a lot of CE courses with different aspects of dentistry. So that's how it got me to where I want to be now.
Yeah.
Congratulations.
Yeah. And as we mentioned in the introduction, you have many accomplishments in the implant sector of dentistry. What can you tell us about how far the implant industry has come from when you first started implants to today?
Oh yeah, it comes so far. I mean, the industry had evolved so much. I remember when we used to do R and X, cases. It take you to take multiple appointments, like, and it take almost like 6 months to a year to finish the case. And you have to analog version where you take impression and then trial and error, and sometimes too much time, too much. Uh, uh, Visits, too many visits involved, So I think now we can finish everything within a day, So
Wow.
with all the new advancement in surgical techniques, prosthetic techniques also, and also digital work, digital dentistry, actually
Yeah.
help with the implant, uh, you know, procedure.
Yeah,
Yeah.
absolutely. And I a lot of dentists, they struggle to even get to 5 arches per month. And here you are doing 30. I mean, that is incredible. You figured something out that a lot of dentists haven't. So, what have you noticed has helped you or has been the biggest factor that's gotten you from like 5 arches to 30 per month?
I think the biggest thing of what moving from 5 to 20 to 30 or to the more, I think got something to do with the marketing.
Okay.
You got to be able to do marketing.
Yeah. So, like, would you say hiring on a marketing company to help you with that, or were you able to do that on your own?
Or you're probably gonna have to involve with marketing company. They can help you maybe do online marketing, or you can do whatever marketing you want, like TV, radio, um, Google Ads, social media stuff. So whatever you want to do, depend on how many
Yeah.
cases you want to get.
So, like, let's say that someone, wants to do 30 like you. What would you say, or what's been the most helpful for you in terms of marketing? Like, which kind of marketing's been the most helpful? Like, like TV or like internet ads? What do you think?
I think it's gonna be the TV marketing and also
Oh, wow.
social media.
Oh, the
The
social
other thing
media.
I think is very helpful too is referral, word of mouth, or
Ah,
reputation.
okay.
I mean, if you someone that been doing it for a while, and you have good result with cases you done, and then you know how when you change life, right, it spread. People
Mm-hmm.
will refer their friends, their family to your practice, and their co-workers. So all that, I think it count too. And also when you good though, I think it spread really fast. I think social media is the key. Especially when you show that you change so many lives, and it show on your picture, before and after pictures and video testimonial, or those things. I think it's gonna help with your increase your number of cases, or maybe you get more consultations, going in.
Yeah, like internal referrals.
Yeah.
Wow.
Also,
Yeah.
like if you do general dentistry, right, for many years, and you start doing on four on X's, cases, you got some referral from general dentistry patient too, and then those
Mm-hmm.
can turn into on X patients.
Wow. So
Yeah.
you're saying if you have a general dentistry office
Yep.
and you're offering all on X,
Yep.
then you'll have a lot of patients move from your internal referral pool
Yeah.
into your all on X pool
Yep.
naturally.
Yep. So if you have 2,000 or 3,000 patients in your general dentistry pool, all those patients gonna need implants. So you
Hmm.
just have to find a way to diagnose it, and then talk them into doing RNX.
Yeah.
Absolutely.
So expanding on that, looking at a revenue standpoint, implants are like the big cases, so they're much more profitable than the general dentistry part. What can you say regarding the value of providing full arch implant services in a general dentistry practice?
Oh yeah, I think the revenue for bringing the on cases into general dentistry practices, I think it's huge. I think it's going to be very profitable, and then you can boost up your revenue monthly, revenue from 100 to 2 to 300,000 on top of your general dentistry revenue,
Wow.
and then you
Yeah.
can do like 4 to 10 arches a month. I think it's doable.
Very doable.
Yep.
So, a lot of dentists say that adding implant dentistry, especially all on X dentistry to your practice, is very profitable, like you just mentioned. So, if a dentist wants to double the value of his practice, let's say that a dentist is collecting like $1 million a year from general dentistry. How many arches do you think that he would need to add in order to maybe double the value of his practice?
Or 5 arches a month.
That's not bad.
Yeah, well, you can do 1 arch a month. I mean, one arch a week. You should double that up.
That's incredible.
Yep.
How
Yeah.
long have you been doing about at least 5 arches a month for? I mean, like, I know that you've been doing more than that, but how long ago were you only
Oh,
doing
I
five?
started my implant journey back in 2007. I
Wow.
graduated in 2004, but we were doing single implant from 2004 to 2007, and then from 2000 until later. I mean, maybe in 2000, we do 4 or 5 arches a month.
And wow, that early on.
Yep.
My goodness. Okay, how long have you been doing about 30 arches a month for?
Maybe not long ago. Maybe probably 2 years.
Oh, wow. Okay.
Yep.
So it's taken some time to build up to that point.
Yep. I think
Do you?
what happened is like you have to have some kind of a support system, meaning in order for you to do all like 30 audits, you have to make sure your tasks up to par. Your staff, they have to be well trained
Mm,
surgical assistant. You got to make sure your front desk and your treatment coordinator have to know how to do consult so you can close
mhm.
cases. Also, like you got to make sure you know digital workflow. If you don't acquire digital workflow like photogrammetry and stuff, like digital impression or all the scanner, and
Yeah.
I don't think you can be able to do even 20, 30 odds a month. I think it can be hard. And also you have to be, uh, like acquiring surgical skill, to be able to do
Yeah.
advanced cases, So all that,
Do them quickly.
you
Yeah.
know. So I think they take a lot of steps to be able to deliver, like 30 odds a month. You know what I'm saying? So it's not happening overnight.
So you're saying that the problems or the challenges that you face at getting to 30 arches a month is different from the challenges doing only five.
Yeah, of course. You gotta be
So
able
you're
to speed.
saying,
You gotta be able to, be be I think efficient, and then you gotta have speed, and you gotta
yeah.
know it have to be the right way. Sometimes you can be fast, but then you sloppy. You can you can get yourself in trouble, and then there gonna be complication gonna happen. Not only just
Exactly.
surgical complication. We talk about prosthetic complication. And then also after you deliver the case doesn't mean it's gonna go smooth. A lot of patients have we call airway obstruction sleep apnea, and then they have grinding clenching. They have neuromuscular
Mm,
issue where they grind and clenching their teeth so much, and then that will cause implant to fail. So you have to
wow.
address the thing, so that your cases can last a little longer than normal. So
You really are experienced in the sleep apnea as well. How valuable has that knowledge been in your all on X journey, knowing how to do the sleep apnea and airway treatment?
So with my practice though, I think what set us apart from every other implant center is like because my background we used to do a lot of smile makeover with veneers and crowns. and with full mouth rehab, with open bite and stuff, and that's gonna help me with the smile design for my on cases. But then on top of that, back then I used to have a lot of issue where my veneers and crowns start breaking down. I mean, patients start having pain, infection, and I don't know what the cause of it. We call root cause of the issue. So I went
Hmm.
back to school and I start figured out, okay, so I need to learn about occlusion, the bite, because
Hmm.
the occlusion, the bite, the foundation of everything we do in dentistry. So I went back to school. I started learning. I got some training in TMJ, jaw alignment,
Hmm.
and then by correction, and then also micro occlusive by adjustment. So all those
Hmm.
things actually help me right now. And also I got 1 year. Uh, I did 1 year mini resident in sleep apnea. So be able to combine all these things into what
Wow.
I do, though, I think it helped my patient uh, get out of pain, and then and then we'll find out uh, what the root cause of their problem, and then be able to help them get out of pain, and then be able to sleep and breathe better, and then they look healthier, because when you sleep well, you look better. You don't
Yeah.
sleep well, if you like stay up all night, you will see the next day, you will see look groggy and tired, and then you have a lot of like back underneath your eye, and
Yeah.
then you can tell you don't look healthy, so that's why sleep breathing issue, can cause a lot of problem. And then if you grind your teeth a lot too, you start having jaw pain, headache right here, jaw pain right here, and then sometimes you have some ear pain, neck and shoulder pain, all those things. It's caused by TMJ issue, jaw alignment problem. So when we do the case, though, we have to make sure we capture the neuromuscular bite, or we call it the optimized bias, and we
Right.
use that from the get go, from the beginning until the end. We follow that, so we keep everything the same.
Wow. Incredible.
So, for the dentists learning implant dentistry, could you explain the importance of mentoring them along the way so for their first few All on X cases, they're not too stressed or overwhelmed?
Oh yeah, I think mentorship is very important. I didn't have any mentor help me throughout my years
Oh
of doing
no.
it. So like kind of
Oh,
like a
wow.
trial and error. So you're gonna run into complication and you don't know what to do. So I think having a mentor is gonna be a advantage, because when you run into problem, you can call somebody up and you say, "Hey, I have this. How can I correct this issue? How can I fix this?" So when you have somebody that kind of like listen to your problem and then be able to answer, give you some solution for the problem you have, I think it's going to be very advantageous.
Yeah, I think that your knowledge and expertise beyond just all on X, your ability to understand sleep apnea and clenching and TMJ health and the neuromuscular component of everything, it combining both of those into one ideology is so incredibly useful when you're treating patients, because like you just said, patients, they can have failing implants if they grind, if they clench,
Yep,
if they, if their occlusion is if their occlusion is off.
yep.
So I think that you made a great point when you said that you offering those services to your patients is what sets you guys apart from a lot of other implant centers. So I think that your mentorship and people learning from you would be incredibly valuable. Do you offer or do you have any mentees that you've been helping with these kinds of things?
Oh yeah, I do have a couple. They from different areas. Like I got one friend. Like we train together with TMJ's neuromuscular stuff. So he not very advanced with the RNX. So he flew down here and then watched me do surgery, and he been doing it, and then watching me doing it, and then I was able to tell him what the right way to do it, some shortcut or whatever that make things go faster and more efficient for him. So I think, and then we have some other two call me and ask me some questions here and there.
Yeah. I have a question. Are you is an institute in the works at all?
No, not right
For
now, but I think in
not right
the
now?
future, yeah.
Oh, in the future. Okay, that'd be really cool. Like, I think a lot of people would love to learn from you.
Yeah, but the thing with me though, I collect a lot of data. Like I take a lot of picture and video, so I got a lot of stuff that I can use it to show people. I mean,
Yeah,
we have good results with all the cases we done, and it show, and when we have those uh, in our hand, so we'll be able to use it and utilize it, and then show people that how we we start the case and how we finish the case. So I think it's very important later
awesome.
on down the road if we want to train some other people down the road.
Awesome.
So, what trends do you see shaping the future of implant dentistry over the next few years?
Oh yeah, there's a lot.
A lot.
Yeah,
Yeah.
I can name a few. Um, I think the one thing that catch my eye right now, I think robotics is one of the things that we're heading in the future, implant dentistry in the future. CAD CAM technology,
Hmm.
um, and then all the new scanning, milling machine, 3D printing is big too. Uh,
Yeah.
3D printing and also on had come to um, a point where we're very advanced, with the surgical and prosthetic and smile design. So all of that, it's gonna be huge. And also nowadays we do things a little bit we call like minimally invasive surgery.
Yeah.
So it can be easy, fast, painless, and less appointment, and then
Wow.
predictable nowadays. So
There's so many different things.
yep.
Yeah, like the
Also,
robotic
another thing
component
too I
is
want
so
to mention
exciting.
too it IA, um, artificial intelligence.
Oh,
Yeah,
yeah. Artificial
yeah,
intelligence.
that can be
Artificial
huge too.
intelligence. Yeah.
Oh, absolutely. I totally agree with you.
Yep.
So,
So I'd
how have
love
you
to have you on again at some point in the future to talk more about maybe 3D printing, robotics, AI,
Yeah, yeah,
you know,
yeah. Artificial intelligence. Yeah,
that'd be so much fun
yeah.
and see
Yeah.
how you're incorporating it. You know, if someone wanted to reach out to you and maybe ask you a couple of questions, um, regarding some of their cases, or if they could maybe come by and maybe watch you perform a case, would there be a way that they could contact
Oh
you?
yeah, yeah.
Maybe by email? Yeah.
Email or you can reach me by phone side too.
Okay, what would what would that phone number and email be?
You can email me to Cory CORYDDS at yahoo.com. That's my email, and
Perfect.
they can you know message me on my follow me on Instagram
Yeah, what's your Instagram?
Beyond Dental and Implant Center.
All right.
Yep.
Perfect. Well, thank you so much, Dr. Corey, for coming on and teaching us so much about, you know, all of these important topics. We really, really appreciate you for spending this time with us.
All right. Thank you so much for having me.
Y-
We had
Of
fun so
Yes.
course.
far. Yeah.
Of
Yep.
course. Yeah. So, you guys, thanks for tuning into the Revolution Dentistry podcast. If you're finding value here, make sure to hit subscribe so you can never miss an episode. We're here every week to help you grow. All right. See you next time, guys.
Bye, everyone.
All
Thank you
right.
so much,
Thank
Dr.
you.
Corey.